Hello everyone. Today in this lecture we are going to discuss about heart failure. As we know, heart failure is one of the leading cause of death in children less than 5 years of age. So you have to know the basic of heart failure, what is the definition of heart failure, what are the causes of heart failure, what are the signs and symptoms of heart failure, what are the pathology of heart failure, and what are the drug present to treat the heart failure and how to treat the heart failure. So in this lecture we have to discuss all the things. So let's start with the definition of heart failure. So as we know, heart is the organ which transfer oxygenated blood to all the body parts. So when heart is unable to transfer all the oxygenated blood to the body parts, then there is a decreased amount of oxygen to that organ or all of the organ of the body. So then that means when heart is unable to pump enough blood to meet the body need of oxygen, then there is a organ failure, and this leads to MODS. This means multi-organ dysfunction. So that means when heart is unable to pump enough blood to the body parts to meet the oxygen demand, then it is called heart failure. So this heart failure is having three different causes. First, when there is a normal heart is there, but structurally it is normal, but heart is unable to pump enough blood. That means when the blood is less, then oxygen also less in the body. Then there is a signs of heart failure because there is a decreased amount of oxygen the body and decreased amount of the blood in. So heart is not able to meet the body demand of the oxygen. So normal heart with symptoms of decreased oxygen supply to the body. Second is structurally problem heart. That means abnormal heart structure with decreased amount of oxygen in the body as the heart is unable to pump the blood. And last is heart is normal but there is a problem in the heart rhythm. That means heart is normal, structurally normal, but there is a rhythm problem in the rhythm that leads to heart unable to pump enough blood to the body. So these are the three different causes of heart failure. So let's go to the causes of heart failure. As we know, most common cause of heart failure in children is congenital heart disease, and among them, VSD is the most common cause of heart failure. So this is an MCQ. So most common cause of heart failure in children is congenital heart disease, and most common congenital heart disease which causing heart failure is VSD. There are lots of other congenital heart diseases there and which leads to heart failure, and these are the list. We don't have to go details in this. Next is when there is a heart is structurally normal but heart is unable to pump enough blood to the body to meet the oxygen demand. That means normal heart is structurally normal. So what is the most common cause of heart failure in a patient where there is a heart is structurally normal? It is cardiomyopathy. This is an MCQ. And the most common type of cardiomyopathy which leads to heart failure is dilated cardiomyopathy. So, as the MCQ said, most common cause of heart failure is congenital heart disease with heart failure. Most common cause of heart failure in a patient where there is a heart is normal, that is cardiomyopathy. And most common among them are dilated cardiomyopathy. Other causes of structurally normal heart failure are like anemia, as I said before, there is a decreased amount of blood, sepsis, in which there is a acidosis in the body, or which causing myocardial infarction and myocardial contractile problem. There is arrhythmia, as I say, and there is some metabolic problem like hypocalcemia, malnutrition, vitamin problems, infection, and so on. So these are the causes of heart failure in a normal, structurally normal heart, and these are the causes of heart failure where there is a structural problem in the heart, either muscle or in the septum or in the valve. Now go to the pathophysiology of heart failure. So as I say, heart having four chamber and there is a septum in between the chambers. So this is right and this is left. So when blood comes from the body, the deoxygenated blood, and enter into the right side, right atrium, then left right ventricle, then into the lung, and from the lung it comes to the left atrium, then left ventricle, and then to the body. So when there is a heart failure due to problem in this right heart. That means right heart is unable to pump enough blood to the lung. There is a decreased amount of blood in the lung, and this blood do not enter. Decreased amount of blood come to the left part, and there is a decreased amount of blood in the body. So this is called right heart failure. That means right heart is unable to pump enough blood to the lung. So what may be the causes of right heart failure? That means a high amount of fluid or high amount of blood present in the right sided, and there is a contractile problem or myocardial problem or something else. That means high amount of fluid in the part. This may cause right heart failure. And the left heart failure, what means by left heart failure? When there is left heart is unable to pump enough blood to the body, that is left heart failure. That means the left blood is come from the right all of the bodies and enter into the lung, and this blood comes into the left sided left atrium, but and then the left ventricle, but the left ventricle unable to pump the blood to the body. The causes may be either due to there is a stenosis in the valve, or the left heart having some obstruction in that part. That means aortic obstruction or hypertension on that area, that may lead to heart failure. So these are the main pathology of two types of heart failure. That means right heart failure or left heart failure. And there, when the heart failure is both simultaneously, that is called congestive cardiac failure. So we divided heart failure into majorly two types: right heart failure, left heart failure. And when there is a simultaneously of both are having failure, then it's called CCF, that means congestive heart failure. As we know, cardiac output is based on, that means cardiac output means how much amount of blood is ejected out from the left ventricle is called cardiac output. So as I say before, the all of the blood from the lung enter into the left sided atrium, then left ventricle, and this goes from the left ventricle to the body. So when cardiac output is measured, a cardiac output means there is a the amount of blood comes from the left ventricle to the aorta is called cardiac output, and this cardiac output is depend on the heart rate and systolic volume. That means the stroke volume and the heart rate. So when there is an increase of heart rate, there is an increase of cardiac output. When there is an increase amount of stroke volume, there is an increase of cardiac output. But it is to some extent. Remember, when the heart rate is increasing to a certain point, there is a when heart rate is increasing, heart rate having systolic time and there is a diastolic time. When the heart rate is increasing, the diastolic time is decreasing. The systolic time is constantly small or low. So as the diastolic time is decreasing, so that the heart having enough not enough of time to fill the blood. So the left ventricle is not filling much amount of blood, and this small amount of blood is from the left ventricle. When there is systole, it ejected out to the body. So small amount of blood come out from the left ventricle to the body, and which leads to heart failure. So that means when there is a high increase amount of heart failure, this also heart rate to increases the cardiac output, there is a decrease some after some point there is a decreased amount of cardiac output, which leads to again heart failure. So that's why we are giving enough heart time for the heart to fill out filling. So when there is a signs of heart failure, there is a tachycardia. So we have to treat the tachycardia, because when there is a tachycardia, there is a decreased diastolic time and the diastolic filling is low. So we have to treat the tachycardia with a beta blocker to decrease the heart rate. And stroke volume, this stroke volume means how much amount of blood ejected out from one stroke from the left ventricle to the aorta. It is called stroke volume. So stroke volume is mainly depend on three parts. One is preload, one is afterload, and last is cardiac contractility. So preload means the amount of blood which is comes from the body. As I said, from the body, blood comes into the right atrium, then right ventricle, then to the lung. From the then it is come to the left atrium, then left ventricle to the body. So the amount of blood which is comes from the body to the right atrium and then to the right ventricle, it is called the preload. So preload means right heart phenomenon. And afterload means the amount of blood which is comes from the left ventricle to the body is called afterload. So preload is depend on the firstly preload is depend on the amount of blood come to the right sided. That means preload is mainly depend on the volume of blood, venous return, and also the body position. That means when there is a sitting posture or the patient or the child having in lying down position, there is increased venous return to the heart, which causes increased preload. And also there is intrathoracic pressure interpericardial pressure. When there is increased intracardial pressure or intrathoracic pressure or interpericardial pressure increase, then there is an increased amount of blood comes to the right sided and cause increased stroke volume and also increased cardiac output. And afterload is depend on three parts. First is the peripheral vascular resistance. It is very much important. PVR. This that means the resistance in which the heart have to pump out the blood, against which the heart have to pump out the blood. That means the aortic pressure. So peripheral vascular resistance is very much important for afterload. It is disproportionate. That means when the PVR is increases, stroke volume is decreases. When the PVR is decreases, the stroke volume is increases. Then the left ventricular volume, as this left ventricular volume is also depend on the right preload and also the left ventricular wall thickness. And the lastly is the physical characteristic of the arterial wall. That means elasticity and the cardiac contractility is also depend the afterload. And last is the cardiac contractility. That means the amount of cardiac contraction of in each beats. When there is a cardiomyopathy, the contractility of the heart is decreased and that leads to decreased stroke volume and which causes heart failure. So these are the three factors which is very much important for the heart failure. That means preload failure, either there is a afterload failure or there is a contractility failure of the heart. So preload failure means there is a decreased amount of blood enter into the right sided heart and the right sided heart is unable to pump enough blood to the lung to, and then there is enough less amount of blood into the left ventricle which is go into the body. That means there is a failure of the right heart failure. So preload failure means right heart failure and afterload failure means there is a increased amount of vascular resistance against which the heart cannot pump enough blood to the all the bodies and that's causing heart failure of the left heart failure. So that means left heart failure is a type of afterload failure and contractility failure means when the contractility part of the heart is decreased, that means congestive heart failure. So CCF means contractility failure, left ventricular failure means afterload failure, and right ventricular failure means preload failure. So heart failure is divided into three types. That means, as I said, left heart failure, right heart failure, and congestive heart failure. This means what are the signs and symptoms of left heart failure? That means left heart is unable to pump enough blood to the body. As there is a left heart is unable to pump enough blood to the body, so the blood is accumulated in the left ventricle, and this blood is going backwards to the lung, causing lung, causing lung edema. So that is the heart. When the left heart is unable to pump enough blood to the body, so there is accumulation of the fluid, or that means blood in the left side. As the right side is normal, so blood comes from the body, enter into the right ventricle, right ventricle, and then go to the lung, and then into the left side. But left heart is unable to pump enough blood to the body, so there is accumulation of blood in the left atrium, which causing pushback to the blood into the lung, and this high amount of fluid in the lung causing bilateral basal crepitation, and there is a dyspnea, orthopnea, and cough. That means bronchial asthma or cardiac asthma. This is called cardiac asthma. As the blood in the lung, which is present in more amount of blood in the lung vessels, which pressurize the bronchus, and there is a shortening of the diameter of the bronchus, which causing the spasm of the bronchus and causing asthmatic cough. That is meant cardiac asthma. So what are the causes of signs of right heart failure? So in right heart failure, the heart is unable to pump enough blood to the right heart to the lung. So that means the right heart having accumulation of blood in the right heart, right atrium, and also in the right ventricle. This blood get pushed back and enter into the body. So the first the blood goes to the SVC, causing I pulsatile jugular venous pressure. That means pulsatile I SVC. Then there is a blood pushback into the liver and causing tender hepatomegaly. So why tender? There is a acute hepatomegaly of the left of the liver, and which causing hepatomegaly, which is tender in nature because the stretching of the fascia. And last is the pedal edema. So there are the signs of right heart failure is bilateral pedal edema, tender hepatomegaly, and jugular venous pressure, which is pulsatile in nature. And what are the features of congestive heart failure? Congestive heart failure means both of the two is called congestive heart failure. So when we found there is a basal capitation, and also there is a pedal edema, and also hepatomegaly, tender hepatomegaly, and increased IVC, that means it is called congestive heart failure. Now, other type of heart failure is systolic heart failure and also the diastolic heart failure. Systolic heart failure, as I say, means in during systole, heart cannot pump out blood from the ventricles to the lung or to the body. That means there is a problem in the ventricle, left ventricle or right ventricle, causing systolic heart failure. Or when the diastolic failure means when there is a decreased amount of blood accumulation in the heart. That means heart is unable to take enough blood for the during the diastole, which is lead to decreased amount of blood in the heart, which to go through the ventricles to the body. So systolic failure is signs of systolic failure is poor ejection fraction. That means cardiac output is low. As I say, cardiac output is low, and there is a gallop rhythm, and there is a weak and thin muscles. And diastolic failure, there is the S4 sound is there, and left ventricular hypertrophy dilatation is there, and there is a decreased relaxation and feeling of the heart. As I say, the features of heart failure, in left heart failure, there is a bilateral basal capitation, respiratory distress, peeing for the sputum, and intermittent fatigue with sweating of the forehead. And right heart failure, the features are tender hepatomegaly, raised JBP, bilateral pedal edema, and respiratory distress in both of them. And congestive cardiac failure, as I said, then that means both right and left heart failure, that is respiratory distress, tender hepatomegaly, raised JBP, bilateral pedal edema, capitation of the basal, and poor pulse volume. That is the signs of congestive heart failure. Now, when we see any patient having heart failure, so we divided the patient into two parts for the treatment of the heart failure. Before the treatment, we have to see the patient and see the symptoms of heart failure. If the symptoms of heart failure is there, then we divided the heart failure into two parts. One is there any congestion present or not? Is there any congestion present or not? We have to see the congestion. That means the fluid is accumulated in the body or not. As I say, congestion means there is a problem in the preload. So is there is a preload failure or not? And second is the perfusion is low or not. That means there is a afterload failure is present or not. So these are the two parts we divided for the treatment, basic treatment of the heart failure. So when we see any patient having heart failure, we divide it into two parts. First is there is a congestion present or not? Yes or no? And there is a perfusion pressure is normal or low. That means patient is present with shock, heart failure with shock or not. So if there is a congestion is there and the perfusion is normal, that means perfusion is normal but the congestion is there, then it's called wet and warm failure. Wet and warm failure means there is a preload failure or right heart failure. So what do you mean by when there is a right heart is having failed, right heart failure is there. So blood is come into the right heart, but it cannot go into the lung and it cannot go into the body. So there is a failure of the heart, but the right heart is failed more than the left heart. So there is a preload failure means wet and warm. Wet means there is a congestion as the fluid accumulated in the body, and warm means there is a periphery is warm. Periphery having some perfusion. That means the ejection fraction is more than 40%, but the demand is much more higher than the supply from the heart, and there is a accumulation of fluid in the body. So this is wet and warm failure. And when there is a congestion is not there, but there is a perfusion is normal, then it is called warm and dry failure. This is the condition in which we want to put a patient when there is a signs of heart failure. So we have to try the patient to in this part, that is dry and warm. So that means dry means the body there is a no signs of congestion, and the warm means there is a peripheral perfusion is also there. When there is congestion is not there, but there is the perfusion is also low, that is called cold, wet and dry, or cold and dry. So that means congestion is not there. That means there is a no right heart failure, but there is a afterload failure. That means left heart failure. When there is a left heart failure, there is a severe failure. When the ejection fraction is less than 40%, but the right heart is normal, then it is called cold and dry failure. That means the child is in shock. This may seen in some problem of afterload failure, or in when there is a decreased amount of fluid or blood in the body. And on the other term, when there is a congestion is there and the periphery is cold, that is called wet and cold failure. That means the right heart is also failure, and there is a decreased perfusion. That means ejection fraction is also low. That means there is a CCF, congestive heart failure. So it is called cold and wet. So in this part, there is a decreased amount of ejection fraction, and also there is a right heart failure. So this is the most critical condition. We have to treat this patient seriously, and this is the one of the most common condition we are found in our day-to-day practice. So we have to know the treatment according to this chart. So when there is a patient comes with a heart failure, we have to see if there is a congestion present or not, and the perfusion of the heart. And if there is a perfusion is low, that means the child is in heart failure with shock. And when there is a congestion is there, that means there is a right heart failure. When there is a right heart failure along with shock, that is called congestive heart failure with shock. When there is only right heart failure without shock, that is means right heart wet and warm failure. So this is the basic, as I say, wet and warm failure. Wet and warm means there is, this is the heart, there is a right heart failure, this is right and this is left, this is right heart failure. That means wet and warm. That means the ejection fraction, that means cardiac output is normal and blood pressure is normal, but there is, and peripheral perfusion also normal, but there is a features of preload failure or right heart failure. That means bilateral pedal edema, raised ABP along with tender hepatomegaly. Wet and cold failure, that means the wet means congestive cardiac failure with shock. That means the heart having both right heart and left heart failure along with the shock. That means the ejection fraction is very much low. The blood pressure is also low, the peripheral perfusion also low, and there is features of congestive cardiac failure. And dry and warm failure. That means there is a afterload failure, the left heart failure. The right heart is normal. That means cardiac output is quite normal as there is a warm, but the blood pressure is also normal, and there is a features of afterload failure or left heart failure. That means the heart is unable to pump enough blood from the left heart to the body, but the cardiac output is quite normal to manage the demand. So this is dry and warm failure. It is in afterload. It is also called afterload failure, and the signs are bilateral basal palpitations along with respiratory distress. And last is dry and cold failure. It is dry means there is a no congestion is there, and cold means the periphery is in shock. That means there is a decrease high low cardiac output, and there is a blood pressure is low, and peripheral perfusion also low, and there is a features of left heart failure. So this is afterload with shock. Afterload failure, that means left ventricular failure with shock, and this is only left ventricular failure. Now the treatment. So goal of the treatment is to minimize the mismatch between the metabolic demand and the supply. That means it is we are targeting to give enough oxygenated blood to the every organ of the body, so leads to decrease modes. So our main motto is to increase the cardiac contractility and also decrease afterload and also increases the venous return to the heart. That means the blood is able to pump enough blood to the every organ of the body. So increase the cardiac output and relieve the failure of heart failure symptoms, and palliative treatment or curative treatment if there is a structural problem. So first is the general measurement. When the patient comes to your hospital emergency with the features of heart failure, then always do the ABCD of a patient. That means put the patient in supine position as with semi-reclining upright position in 30-degree or 45-degree, as because this decreases. Why this 45 semi-upright position? Because when there is a semi-upright position, the venous return to the body is decreased, and this causing no decreased amount of venous return to the heart, as there is a heart failure with preload failure, and there is a when there is a preload failure, so we have put the patient in upright position, semi-upright position. When there is a afterload failure or when there is a shock, patient is in shock, we put the patient in a supine position with taking the legs up to the from the base. That means we put the legs above the head to increase the venous return when there is a shock. And then it's the administration of the ABCD. ABCD means A means airway. So seeing the checking the airway is patent or not. If there is a secretion present, which then we have to clear the secretion. Breathing pattern, we see the breathing pattern, and also giving the oxygen when the saturation is less than 95%. It's very much important to keep the oxygen saturation more than 95%. And check the circulation. As I say, we divided into perfusion and also the types of heart failure. When there is a warm body, that means warm failure. When there is a body is cold, that means cold failure. Cold means in shock. When the child is in shock in heart failure, we have to give. When there is a dry and cold failure, we have to give fluid much more than the when there is a warm when there is a wet with shock. That means when wet plus shock, we give bolus slowly over 10-30 minutes, fast bolus, and after that, when if the child having in shock, then we have to repeat the dose. But if there is cold failure along with there is a dry, then we give the fluid as early as possible, and it is in bolus. So what are the drugs for the treatment of heart failure? As I say, heart failure is divided into three parts. That means right heart failure, preload failure, or left heart failure, or afterload failure, or congestive heart failure. So we have to treat the patient according to different types of heart failure. So first is the diuretics drugs. That means diuretics is treatment for the preload failure. Inotrope is the treatment for the left heart failure and also increases the cardiac contractility. And afterload reducing agent is mainly present where there is decreasing, this means the vasodilator or the arterial dilator. So when the patient present with wet and warm failure, so when the patient present with wet and warm failure, that means right heart failure. So we start with a diuretics. That is the when there is a wet but the patient periphery is warm. That means the perfusion is good, but there is a features of right heart failure. So we have to decreases the preload. So this first start with the diuretics, and after that we add AC inhibitor and carvedilol. So while AC inhibitor decreases the afterload and also some amount of preload, and cardiac, and also it does the cardiac remodeling, prevent the cardiac remodeling, and carvedilol is for the cardiac contractility. So when start with a diuretics when that symptoms is not improving, along with diuretics, then start with AC inhibitor, give AC inhibitor and carvedilol. Next is wet and cold failure. That means the patient having symptoms of right heart failure along with shock. So we start with diuretics along with inotropes. So inotropes increases the cardiac contractility and also the decreases the it increases the cardiac contractility and increases the myocardial demand also. So first we give diuretics and inotropes for the treatment of wet and cold failure. The inotropes, first line of inotropes, when there is heart is structurally normal. When the heart is structurally normal, we give diuretics with dopamine. And if the heart is structurally problematic, that means structurally abnormal, along with cold and shock, then we start with dobutamine. If the child is normotensive, sorry, we start with adrenaline. So when there is a wet and cold failure with structurally normal patient, we start with normal heart patient, diuretics along with dopamine. And when there is structurally abnormal heart, that means then start with diuretics and adrenaline. And after that, if the symptoms is not improving, we give digoxin. But digoxin is not given in acute phase. And dry and warm failure. Dry and warm failure means there is a failure in the left heart afterload. So decreasing the afterload by giving the AC inhibitor, which is arteriolar dilator. And second line, if the symptoms is not improving, then we can give digoxin and carbidopa to decreases the afterload also, and also decreases the heart rate of the patient. And dry and cold failure, that means the child is in shock with no features of period failure, then we give milrinone and adrenaline. That means increasing the cardiac contractility, also the myocardial contractility, and increasing the peripheral vascular resistance also. So these are the treatment of heart failure. Now the inotrope drugs. As I said, dopamine, it is increases the cardiac output and also the cardiac contractility and also the blood pressure. So it is given when there is a hypotensive shock. So hypotensive shock with or without dry or wet failure. That means congestion, if congestion is there or not, it is not necessary to see. Dopamine is given when there is a hypertension is there. Dobutamine is given when and it increases the cardiac output but it decreases the blood pressure. So in normotensive shock, that means warm and wet patient, in warm patient we can give dobutamine when there is a low cardiac output but the blood pressure is normal. Adrenaline is also increases the blood pressure, so it is given in hypotensive with low cardiac output. Milrinone is also increases the cardiac output and contractility, but it decreases the blood pressure. So it is given in normotensive with low cardiac output. And levosimendan also decreases the blood pressure, so it is given in normotensive with low cardiac output. So these are the treatment of heart failure. So we have to treat the heart failure accordingly by this chart. That means wet and warm failure, wet and cold failure, dry and warm failure, dry and cold failure. Wet and cold failure with normal cardiac output, we start with dopamine along with diuretics. With structurally abnormal heart, we give adrenaline with diuretics. You have to remember this. These two is the most common condition which is we are facing in non day-to-day practice. And this is the condition where it is for the post cardiac surgery when there is a periphery is cold and there is a dryness of the body. So this is after post surgery. So these are the treatment of heart failure. Thank you.